Dr. Chen is dedicated to what may seem like the impossible.
This constant puzzle of what's happening in my brain.
She's referring to all human brains that share this complexity, and getting answers to serious problems is hard.
Like Alzheimer's or Parkinson's or brain tumors.
Because the brain is so protected. There are ways, MRIs, CT scans, but
with those imaging techniques, you don't know what's the genetic or molecular makeup of that disease.
She says a tissue biopsy is an option with an invasive surgery.
Removal of a small piece of skull and then insert a long needle and take out a piece of the brain tissue. Only available for brain tumor patient. When patient has Alzheimer's or other disease, we don't even have access to that small piece of tissue. And to get that information, what can we do?
So, the Associate Professor of Biomedical Engineering and Radiation Oncology has a vision for a new method of diagnosis.
It's non-invasive access to small molecules like DNA, RNA, protein, all those small molecules in the brain.
The research in her Washington University School of Medicine lab could even facilitate diagnosis of Alzheimer's disease. Chen is using a focused ultrasound technique that she says can overcome challenges of new emerging methods for diagnosis, such as blood testing. Those challenges are due to the blood-brain barrier that makes some valuable information difficult to access non-invasively.
Our brain is protected by this blood-brain barrier that protect any toxins in the blood from reaching the brain, which we needed dearly.
But Dr. Chen found a way to get through.
We use focused ultrasound, which has a capability to concentrate ultrasound energy in a very precise location deep inside the brain. You can concentrate sound waves to a very localized spot.
Once located, the researchers inject microbubbles into the blood that travel to the ultrasound-targeted tissue and pulsate, which safely opens the blood-brain barrier.
Microbubbles, I always call them magic bubbles. They are gas bubbles. They have a unique capability of expanding and contracting when you apply mechanical wave because they are bubbles, right? And then combine this focused ultrasound with microbubble together, what we achieve is a mechanical approach to generate forces on the blood-brain barrier. This part of technique is not what we invented.
That method was developed for drug delivery to the brain. But Chen says her innovation is a new technique of retrieving biomarkers of diseases.
What we propose is once this barrier is open, we can also get brain disease-specific biomarkers, DNA, RNA, protein, released from brain to the blood. So this part is the innovation that we introduced.
For example, Alzheimer's disease is defined in part by having tau proteins in the brain. Chen and collaborators found that using focused ultrasound-mediated liquid biopsy in a mouse model released more tau proteins and another biomarker into the blood than without the intervention.
What our technology offers is a way to enrich the amount of brain disease-specific biomarkers in the blood, and also providing the capability to target specific brain area to achieve this spatially targeted biomarker release. And then number 3, we now also have the capability to collect the blood at a controlled time after the ultrasound procedure. So we can control when to collect the blood to minimize clearance of the biomarker.
Acquiring valuable information needed for accurate diagnosis of neurodegenerative diseases and much more.
Once this door is open, the application of this technology can be potentially expanded to many other diseases in the brain.